Many young children have significant emotional and behavioral challenges. That presents problems for parents and child care workers. With us now is Shamblin. She's the Director of Early Childhood Mental Health Programs at Tri-County Mental Health and Counseling. Thanks for coming in.
You're welcome.
Let's start with the workshop you were helping to teach this summer about early childhood mental health. Why is it needed?
I think there's a need for this expertise among mental health professionals, educational professionals, and other early childhood workers. It's offered through the Counselor Ed Department, and I had approached them a couple of years ago. I was a graduate of the program, and Dr. Tom Davis and I met to talk about the need for the program or some kind of training. And he said, I'd be glad to help with that if you come and get your PhD. So this has been a 2-year progress, and so we're very glad to be able to offer this locally.
What age group are we talking about here, and what is the percentage of those affected with these problems?
You know, typically when we're talking about early childhood mental health, we're really talking about children in the preschool years, 0 to 6, and the need, I'm sure is surprising to people. Figures range from as many as 10% of children having enough emotional and behavioral challenges to impact their development, all the way up to statistics that show teachers are reporting 30% of children have that many challenges.
Now, are these numbers more or less than in years past, and why?
I'm not sure we know for sure. My sense is that there have always been young children that had challenging behaviors, and we just chalked it up to, you know, they'll grow out of it, which was a very common discussion that parents would have with their physicians. But I also know as a field we're becoming more sophisticated in identifying and intervening much earlier.
What are the warning signs of a problem? What should parents and teachers be on the lookout for?
Well, I think that's a really good question because there's such a range of development in what's typical. But I think any time a parent actually has a concern about their child, they should talk to someone about that, either their physician or an early childhood specialist or their a child's teacher. But particularly if the tantrums are intense and really ongoing, if children are overly aggressive and hurting other children. But again, I would err on the side, if you have a question at all, it's best to ask.
Who is this workshop for? Parents, professionals, others?
This particular workshop through the Counselor Education Department is for people either in the field or students at OU that think they might want to do this work. And it will cover basic social emotional development and intervention strategies. And so I think that would be the most appropriate audience.
We don't have much time left, but how can someone get more information, or how do people go about signing up for this?
So you can actually register through Ohio University's registrar's office, through the My Ohio portal, or people can contact me if they have additional questions or have trouble getting into the class.
All right, Shamblin with Tri-County Mental Health, thanks so much for taking the time tonight.
Thanks.